At Arcwood Financial and Arcwood Benefits Consulting, Arcwood HR, as collectively as you all know us as Arcwood. We are independent organizations and companies. We specifically do not offer legal or tax advice. Our goal is to provide you information so that you can make decisions that are appropriate for you and your firms, which is why we have individuals like Matt and Dennis on the line. Because we like to reserve the legal and the tax work up to those professionals. You know, reflecting back on what Matt had said about the all-encompassing bill, which is 6,000 pages or 5,500 pages, the feds did finally Congress finally did put in a surprise billing act on the federal side of things. It is not effective now. It's going to be effective for plans that are beginning on or after January 1st of 2022. So I'm just going to talk about the highlights of it, but effectively, it's going to be protecting patients from surprise medical care, from out-of-network expenses, which are in emergency situations, or as it's identified as inadvertent treatment situations. And really, effectively, that's defined as I'm going to a network facility. However, inside the network facility, they have non-contracted providers. And so that's kind of being defined on that, and they're specifically listed off, and it's commonly like radiology, pathology, things in that nature. So those inadvertent or emergencies, effectively what they're doing is they're creating an arbitration style dispute resolution. And it's kind of like the baseball style arbitration, if you're familiar with what that term means. On the federal side, it did state that the arbiter is required to consider the median in-network rate, just because in some of the conversations we have through our associations and our legislative teams, there was concern on arbitration could potentially push costs up, just based upon the initial arbitration cases that come through. But the important thing is that patients are going to be removed from this process. It's going to be happening between the plan and the provider. And so it should reduce a little bit of the stress of receiving the surprise medical bills. And there are going to be in government's fashion, there will be a stock new of disclosures and consent requirements, just because we need to make sure that if you are going into a procedure, there's going to be a disclosure that's going to be outlining, is the provider in network? If they're non-network, what's the contracted rate? What's the non-contracted rate? So if a patient signs off on these disclosures, then they kind of get kicked out of this act. So that's, part of it. But again, the federal aspect of us doesn't start until plans that beginning in 2022. And then just kind of following the ERISA guidelines, this is going to be for self-funded plans, because the fully insured plans, they're going to be following state rules. And Arizona did have their surprise billing act become effective, which was on January 1st of 2019. So we still have ours going here in Arizona for the fully insured. However, the self-insured organizations are going to be more impacted by this starting in a year. There are some special rules that came through for the FSA, and effectively what they are is just extensions. So kind of reading between the lines and kind of understanding the spirit of the legislation, the act that was being passed, it's really just making sure that they're opening up some flexibility so that if participants did not have the opportunity to spend the monies that they identified in FSAs, there's extensions. They can roll the monies that were identified in 2020 over to 2021, 2021 into 2022 as well. Grace periods, if your plan document has a grace period identified in there at, I think it was 3 months, it's extended out to 12 months. And then also the reimbursement periods are going to be extended to the end of the planned year for the terminate folks. So it's really all just about flexibility. So if you have flexible spending accounts, remember these are the FSAs that allow us to put money from our payroll kind of aside to pay for unreimbursed medical healthcare expenses. But this is the part that competes with the plans that have the health savings account. So if the majority of participants are enrolled into the consumer-driven healthcare plans that qualify for HSAs, this isn't really going to be a part for them. The FSAs are generally for the employee participants that are enrolling in traditional PPO plans, which are the ones that have that first dollar copay, for office visits, prescriptions, urgent care, and things like that. There is an amendment that is necessary. So if this is something that is interesting or you want to take a look at, just respond back to one of our communications, reach out to us. We'll make sure we get the TPA involved and we can get some of the amendments completed. They're also bringing in some transparency clauses. Again, this is going to be more of a highlight of it. But effectively what they're doing is they're removing a gag clause from contracting, which effectively states is that a health plan cannot enter into an agreement with a healthcare provider, network or association, TPAs, or any type of service provider offering access to a network that would directly or indirectly restrict that health plan really effectively from getting information to operate the plan is kind of my takeaway from it. So they can't restrict the health plan from receiving provider-specific cost or quality of care information. They can't prevent them from electronically accessing de-identified claims and counter information and data for the participants. And there's also provisions in there for sharing information with business associate agreement through a BAA or business associate. As clarification, Arcwood, as a Arcwood Benefits Consulting, we are a BAA to our clients because it just kind of sets our responsibilities of how we communicate under the HIPAA and HITECH Acts, just for managing personal identifiable information, health information, et cetera. But the transparency clauses are really starting to focus on kind of, I guess, peeling back the onion so that we can look under the hood as far as plan operations are going. They're also putting in some different reporting requirements for pharmacy. So there are specific reports that have to be generated from the plans. So it's different from a self-insured organization or plan versus someone who's fully insured through one of the bigger BUCAs of the world, the Blue Cross, United Healthcare, Cignas, et cetera. But there's reporting that has to be provided by the end of this year, effectively December 22nd of 2021. And it's got to talk about the number of employees, the types of drugs they're taking, what the cost of the drugs are, the top 50 expenses in the drugs. And there's a lot of reporting that's going to be going into the service so that they can then start reporting back to us at least 18 months later on, how, what's the impact of prescriptions on our premium pricing. I mean, we know that anyone who's had a conversation with me during our renewal process, we absolutely know what the costs are of prescriptions. They've been increasing rapidly. I mean, I remember when I started in this industry, well, I'm not going to name a number, but a number of years ago, healthcare expenses maybe were 8-9% of wages. And I mean, now we're looking at, 20, 25%, 30% of operating just to kind of support some of the benefit plans. And a lot of that is pushed by prescriptions. So they are opening up some transparency acts through this. Again, there's going to be some time for it to become installed. So that's why I'm just kind of doing the high level things. Also, they are extending the student loans. So under the CARES Act, they did have a permit for an employer to provide student loan repayments in the amount of the $5,250. That was set to expire at the end of 2020, and then that was renewed, and that is now extending out through 2025. I don't think it was utilized very much, just from the information that I'm reading, just purely because of the everything that everybody else is going through from just managing the pandemic in general. But just know that that is something that is available. There's a document that needs to be created. You can't be discriminatory. So there's rules around it. However, if that was something that you were doing last year through the CARES Act, that too is extended through 2025 at this point.